Well, when it comes to menopause, much is said about the mood swings and the hot flashes. There are, however, other symptoms that many women suffer in silence with, mainly because they are too embarrassed to speak with their physicians or their partners about it. So here to shed some light on these taboo issues, Dr. Marjorie Dixon. Hello. Talking about this because we do get a lot of our viewers writing in to talk about menopause, and actually we have very honest discussions backstage all the time. Me and Marilyn Smith have gotten into details in the weeds when it comes to this stuff. But what is the thing that a lot of women maybe are not mentioning when it comes to their menopausal symptoms?
Right, so we've talked about the hot flashes, the not sleeping, the feeling moody, irritable, your joint pain, bone problems, but we've talked a little bit about sexual issues and vaginal dryness and lubrication, but we really we didn't dive. It wasn't a deep dive into the dark circle of the vagina and talking. I guess that didn't sound right.
No, it really is a dark circle.
I'm just, because it is something that we don't know about. Like, we know about kind-of-ish how to get pregnant, we know about our fertility, but we don't talk about menopause in as much as what happens to sexual functioning. If we were men, we have all of these things for erectile dysfunctions. We talk about penises, how to make them harder, longer, but we don't talk about what happens to the receiving vagina.
Yes.
Because there are physiologic changes that happen in a vagina after menopause. So your estrogen goes away. When your own endogenous estrogen, when your ovaries stop making that endogenous estrogen as you're ovulating after the age of 45, it really starts around 45 to 54, that's predominantly an issue. We used to call it atrophic vaginas, or vaginal atrophy. Now we call it genitourinary syndrome of menopause.
Okay, so we made the title much longer.
We made the title longer, but it really talks about all of the tissues of the vagina, the labia minora, the little lips or the bigger lips, also the inside of the vagina. If I do a speculum exam on a woman who is postmenopausal who doesn't have estrogen around, I can tell the difference just visually because the tissue gets thin and it gets shiny and there's not as much lubrication. Even the cervix, the top of the vagina where the uterus is, it fuses with the top. You lose the vaginal fornices. So these vaginas that we're not addressing actually shrink and become friable and thin and drier.
And this so painful.
And well,
did they
drier
hurt?
Can be painful. Well, they can hurt. And a lot of women, it's about prevalent 50% of women. So not everyone will have a dry vagina, but we need to talk about vaginal hygiene. Like, how do we manage this? And how do we recognize it? Even in younger women who have had radiation or who are on antidepressant medications or who are on medications for breast cancer, aromatase inhibitors. So those are all reasons why we need to understand about vaginal moisturizers. And there's an approach to it as a gynecologist that we learn about. So we learn about the baseline. The baseline is, you know how you moisturize your face? You moisturize your vagina. And you can get that over the counter. You can get something like this that you actually apply, and you do it once every 3 days.
Okay.
And so there's a little applicator, you put it into your vagina, and this is your baseline. So you have your daily routine where at night you put lotion on your face, and then you keep looking, you say, am I wrinkling or am I not? So this, you don't look at your vagina so much, but you have your baseline moisturizer. Some people do,
and that's cool too.
But if you wanted to look at your vagina, you could look and you would see the changes if you are dry. And that's the first line of therapy. So when a patient comes to the office and they talk about, I'm feeling a little dry, we don't necessarily right away talk about hormones. We'll start with, have you tried a vaginal moisturizer?
Yeah,
so you do that, that's your baseline.
Even existed.
Yeah, so younger people don't even know this is an issue, right?
Yeah.
This is a big issue because sexual functioning, to some people is unimportant, but to some women it's important. And I think, especially as I talked about the partners getting their penises hard all the time, it's important for the vagina to be able to accommodate, because you don't want to have uncomfortable sex. Okay?
So just a quick question before we go further. Is it just about the sex though, or is there discomfort even without the sex? Because maybe for some women the sex is not the issue. Maybe it's just they're feeling discomfort and like just on a regular basis because of dryness.
Irritated, inflamed. Sometimes people will get fissures, like little cuts, and you'll bleed from them. Yeah, and that's even without sex. Sometimes people's labia will fuse with lack of estrogen, so the little lips will actually become fused with the outer lips, and then people are prone to yeast infections. So you really have to think about the hygiene, the general hygiene. So moisturize first, baseline moisturizer.
Okay.
And then you just talked about sex. So it's sex. For those women who want to have sex and who are needing to have sex, that's not painful, then you add in the lubricant. So some women are using a lubricant as a baseline moisturizer. That's not how it goes. So the first line of therapy is the baseline moisturizer, and then when you're having sex, interspersed with lubricant. So moisturize and lubricate.
You need both.
You need both.
Okay.
And then if that fails you, I've talked to a lot of women, met a lot of women where we talk about hormones. So there was a time where hormones were, it was in the water, everybody said everybody needs hormones, you'll be nice, vagina will be happy, you'll be horny,
nice.
It's all good. But it doesn't work for everyone. But for those women who need that in addition, then there's the hormone stuff that you can add. There are pills that you can put in, there's creams, there's even a ring you can put in, and the ring actually secretes estrogen locally to those tissues, so it helps to get, I talked with Marilyn Smith, we talk about a fluffy vagina.
Fluffy.
She needed, so she wanted a moister vagina, so I talked to her about this, and then afterwards you want a fluffy vagina if you need the additional hormone stimulation.
Moist
to
and
bring
fluffy,
back.
it's like a cake. And you want it to just
I don't know if you want your vagina to be a cake,
moist
but whatever
and
floats your
fluffy.
boat, you know. And then at the end of it, there are all kinds of other things we're talking about sexual dysfunction. So there are other things now. They're looking at laser therapies. We're looking at things we can do to enhance. I don't know if we're looking at things to do to enhance the female orgasm. And every time I mention that, using ultrasound wave technology, you can do these other things. Everybody's like, I can make my orgasms better.
That's amazing.
And then people are like, can I sign up as a test subject? I'm like, well, that's just right. So there are other things. So moisturize, moisturize, moisturize first line if your vagina is dry.
Yeah.
Sex or not.
Okay.
And when your estrogen goes away, that's the #1 reason we see it. It's prevalent 50% in 50% of women, and you do that baseline. And then if you're going to start having sex, or you're having sex and you need a little extra lubrication, forget what you do naturally, because naturally some women, actually you use it lots, you don't necessarily lose it, right? So those women that are very sexually active and use their vaginas lots may not have issue.
Right.
But for those women who do have issue,
you have the option of a moisturizer.
A vaginal moisturizer.
A vaginal moisturizer. See, I learn something new every time you come in here.
I know.
You can just go buy it over the counter.
Over the counter.
Thank you so much, Marjorie, always for your insights on this topic and all the topics.